eating, and I have my lovely, lovely interns here. Time check, we have about 23 minutes before 11 o'clock. It's still Playlist Tuesday, guys. The show is still on. Send in your messages 0810-713-7559. But now we have two beautiful women and okay, a handsome man in the studio with us. I'll be talking about childhood cancer this morning. So September is Childhood Cancer Awareness Month, and is symbolized by a gold ribbon to commemorate the event. We have Dr. Azeezat Ajose, a medical doctor, Luth Research Associate at the Doctors Cancer Foundation, and we also have Aisha, the program associate. Good morning.
Good morning.
Good to have you. All right, good to have you on. I should have said good to have you on the show. And I say thank you for having us. That's how it's done. All right, how are you doing this morning?
Very well, thank you. Fine.
Okay, so we'll be talking about childhood cancer this morning. A lot of people, they have an idea. It's just always an idea that is out there. But when it comes to proper information, the education they need as parents, caregivers, or just as just a normal person, a random person, we all should have that knowledge of childhood cancer. A lot of us don't, but we know that it exists. It's something that is out there that we know. So when it comes to the symptoms, the early diagnosis, people have no idea what it entails. So we're talking about all of that this morning on the show. So starting with you, Dr. Aziza, let's start from childhood cancer.
Yes, so I'll start with what you just said.
Okay.
So you're very correct in that, in the fact that a lot of people do not actually know about childhood cancer. So what we typically see in the hospital is that when parents come in and you tell them that their children have cancer, their typical reaction is disbelief. They're like, okay, yes, they've heard of breast cancer, they've heard of cervical cancer, prostate cancer, but all of these things should happen in adult, and they're surprised that a child can't get a diagnosis of cancer. So yes, we do need to raise that awareness that yes, children do get cancer, and the key to them surviving cancer is early detection and then them getting treated on time. So by way of an introduction, just to understand what cancer is.
Yes.
Basically, every cell in the human body, so back to our basic biology, we're made up of body cells, and all of these cells are typically supposed to grow and die in a coordinated fashion. So just like you one day look at your hand and the skin is peeling off, that's because new cells are generating. So for cancerous cells, so a cell that has been injured, we call that injury mutation, and wants to become cancerous, what typically happens is that the cell stops to die and starts to proliferate in an abnormal fashion. So where you should ideally have 2, it starts to multiply, and then you end up having 1,000, and it crowds out the normal cells that are supposed to do their normal function. So these cells are abnormal cells that keep proliferating, and in certain areas of the body, it actually comes up to form a mass. So they say there is a lump, there is a tumor, and it can spread to all sorts of every part of the body. Now, in children, they have about 100 different types of cancer that can happen to children. So there are different. In adults, over 200.
Sorry?
There are about over 100 types of cancers that can actually be diagnosed in children. So it is a rare disease. Now, that's the first thing. It is a rare disease.
Okay.
But when you say something is rare, once something is rare, once it affects one person, for that person it stops being rare. For their family members, for their caregivers, for their friends, well-wishers, every single person is affected, because the financial burden, the emotional burden gets passed on to all of their well-wishers and friends. So I would say that to raise awareness for childhood cancer, which is why we're here, one of the things people need to know is that it is possible, the different types of cancers that can occur in children, and what symptoms to look out for, and what to do when they see that.
When they see the symptoms. But I won't use the word strange. I'm trying to find a word where, okay, so in that family, there's never been a case of cancer, and then a child having cancer.
Yes.
How?
Yes. So unlike in adult cancers,
yes,
where you can actually pinpoint that, okay, yes, there are risk factors. So perhaps this person smoked a lot, and so the person has lung cancer. In children, a lot of them are too young to actually pinpoint a particular thing that went wrong to cause this child to have cancer. So most of the time, in 90% of cases of childhood cancer, 90 to 95%, there's really no known risk factor. We cannot say this is the basis for it. It just happens, and we have to deal with it when we diagnose a child with cancer. In the rest of the 5% of cases, there are some genetic predispositions, but very rarely For some children that have genetic abnormalities like Down syndrome, they actually have predisposed to certain kind of cancers like leukemias. For some children that have also been exposed to infections, so infections like HIV, hepatitis B, Epstein-Barr virus, some of that actually can actually predispose a child to cancer. But that does not mean that every child that has this infection can get cancer. Like I said, in just 5% of cases, that's when we actually identify risk factors that could have predisposed them to it.
All right. So now introducing the Dorcas Cancer Foundation and you being the program associate, Aisha. Good morning. How has Dorcas Foundation be able to, raise, support for children with cancer?
Yeah, thank you very much. The Dorcas Cancer Foundation is primarily concerned with direct funding of treatment and every kind of support that a child with cancer can have. And it's not limited to just the child. Like she has said, the parents, family, and well-wishers of that child is also affected financially, emotionally. So the Dorcas Cancer Foundation helps every person involved in that child with cancer with direct funding and emotional support and every kind of support you can think of. And also, the Dorcas Cancer Foundation is also initiating a project right now, the Back to School program, that helps childhood cancer survivors to get back to school as part of their rehabilitation.
Okay, because it's always a sad thing to see they have like they've lost years of their life. Yes. So the Back to School.
Yeah, Back to School program.
Every child.
Yeah, we are still seeking for collaborations with private organizations, schools, and other well-wishers too that have it in mind to help every child with cancer survivor get back to school and back to their normal lives.
Okay. All right. So back to Dr. Azeezat. When it comes to the types and variations of childhood cancer, you have said we have like 100, over 100 types of childhood cancer, and we have also talked about the variations. So when it comes to the symptoms, what are the symptoms that we can look out for?
Okay, so the first thing that I would say before I talk about the symptoms is a disclaimer. So not that every child that has these symptoms have cancer. So if a child comes down with fever regularly, the first thing you should actually think of is malaria. Don't think that because your child has fever, he has cancer. So that's the first thing. That's the disclaimer. Now moving forward, so there is no specific sign and symptom that is actually diagnostic of childhood cancer. So all of the symptoms and signs depends on the type of cancer, where that cell is, and that's how the child manifests with it. But then it does not also mean, so I'm going to say that again, that any child that has those symptoms have cancer. So the commonest cancer that we see in children is called the leukemias. That's blood cancer, where the white blood cells that are supposed to fight infection in that child become cancerous and they tend to multiply and multiply. So all the other cells of that child, all the other cells that are supposed to be in the blood tend to be reduced because the white blood cell is excessive in that child's system. So some of the symptoms that children like that come down with include infection. So they have frequent infection. The child comes down today, he has malaria, go to the hospital, give anti-malarials and treat for malaria and typhoid in quotes like they always do. Then the child in 2 weeks time again is back to the hospital, has another episode of fever and infection. They say, okay, this time around is bigger typhoid. By next month, the same child again is back to the hospital for yet another typhoid. No child gets typhoid, no child should get malaria that frequently. So at a point where you have a child coming down with frequent infections, fever all of the time, you find that the child is looking pale and white. So you look at the child's hand, is very white. The child keeps bleeding into his skin, perhaps just by playing just a bit of eating something and the child's skin is already bruised. All of that can be a pointer to the fact that this child has leukemia. And it is not that you should immediately suspect leukemia. It is that a parent, a caregiver at home should take that child to see a pediatrician, that is a specialized doctor to treat children, not just the normal general practitioners that you would see at first. So when a child starts to get frequent illnesses, you should request to see a pediatrician, a consultant that would assess your child properly and decide if this child needs to go see an oncologist or not, rather than continue to self-medicate, take the child to the hospital, pharmacies, and continue to just give anti-malaria. The unfortunate consequence of that self-medication and recurrent treating is that this cancer that probably started at a stage 1, by the time the parent eventually says, okay, it's time to bring to the hospital, the cancer has already advanced to a stage that is more difficult to treat. Now, I would say that the hope that we have, or the good part of childhood cancer, just to put good in quotes,
Good. Okay, in quote.
the good part of childhood cancer is that it's highly curable. So a lot of these cancers have like 90% survival rates in high income
I was going
countries.
to, yes.
In countries where they have access to proper diagnostic services,
Okay.
where there is insurance to fund treatment and the child gets treated easily, you find that 9 out of 10 children actually do survive these cancers. Unfortunately, for us here in Nigeria, our survival rates are still about 20%, just about 2 in every
When the world is
10
having
children.
90%.
Exactly. So all of that points to poor awareness, one of which we're trying to solve. Poor
Okay.
awareness, lack of early diagnosis. So the Dorcas Cancer Foundation actually tries to develop programs that target all of these areas. So we're
Okay.
currently on this awareness
All
session.
right.
We actually train community health workers, we train primary care workers to be able to diagnose these conditions early and refer children to the appropriate settings.
Okay, that's beautiful. The Dorcas Foundation training
Yes.
healthcare workers.
Yes.
Okay. All
So
right.
we actually do that too.
Okay, so developments made so far in the management of childhood cancer. The developments.
So, like I said, that boils down to the survival rate. In the past, we didn't have that. We didn't have this high rate of survival among children with childhood
Okay.
cancer. But now, a lot of time, 9 out of 10 children actually survive this cancer. So, the oncologist, the pediatric oncologist, is the one that manages these cases. And depending on the type of cancer, tells them what to do. So the child can either have surgery to remove the tumor,
Okay.
chemotherapy, which is the use of drugs to kill the cancer cells,
Okay.
or radiotherapy that uses radiation to actually target and kill those cancerous cells. And all of that have advanced so much over the years, and thankfully Nigeria actually has a lot of centers that are treating these diseases now. And all we just need is a little more awareness for people to bring
Yes.
their children to the hospital when they're sick. We need our healthcare workers to have a high index of substitution to refer these children appropriately. We need government and non-governmental organizations, we need Nigerians, well-wishing Nigerians, to actually come forward to help in funding treatment for these children. Because even when we diagnose earlier, sometimes you find that this same child that you diagnosed in February, by the time you tell them that go and bring money for treatment, the money for treatment is 2 million.
Yes,
They'll tell you, okay,
that's it.
they've heard.
That's it.
Now, before you see them again, it's like 2 years time. Now, money
And-
is complete and the cancer has spread. So all of that worsen the survival for our children, and those are the things that we as an organization are trying to work at.
All right. So, what are the current projects in the Dorcas Cancer Foundation?
Okay, like I earlier mentioned, the Dorcas Cancer Foundation has initiated the Back to School program, which is aimed at helping children that have survived cancer get back to their school and
Okay.
educational lives. Right now, we have a couple of children on full scholarships in some schools, and there are still a lot because we're hoping most of our children really survive cancer and really get back to their former lives. So there's still a lot of them that we are hoping to get back to school and resume their normal lives. And of course, we call on philanthropists and private organizations and
yes.
schools that are very compassionate about our children to help them with their school funding and scholarships.
Okay. So, how can philanthropists, private organizations get involved? So, as a person, I want to be a part
Okay.
of the projects happening in the Dorcas Cancer Foundation. How can I be a part of it?
Okay, you can reach out to the Dorcas Cancer Foundation at info@cdcf.ng and send an email for any information you might have or inquiries. And you can also reach out to us on 090-8047-1209.
All right. Yeah, please.
090-8047-1209.
The info again. Info.
info@tdcf.ng.
All right. So, Dr. Azeezat,
Yes.
any other thing you want to let us know about childhood cancer?
Yes. So I would like to also talk about some of our other projects.
Okay. Okay.
Like we actually have the Pediatric Cancer Access Program, PCAP. That's what we call that. Where we
Access
actually,
program.
yes, Pediatric Cancer Access Program.
Access
So
program. Okay.
PCAP.
PICA.
So this is one of our initiatives to fund children with childhood cancer, to fund their treatment, fund laboratory services, all of the things that they may need when they're getting treatment. And this is something that we want to encourage people to key into. So if you do go on our website and you want to key into this, you just need to reach out to us. There are venues for you to donate and help children that are living with cancer.
All right.
That's that. Yes, I think that's basically it. Every other information can actually be gotten on our social media website. But we actually do hope that people spread the gospel of the fact that you should not continue to medicate a child at home. You should not continue to treat a child for malaria incessantly. Rather, try to go to the hospital and request to see a pediatrician to access your child properly.
All right. Thank you. Thank you very